I want to make a difference in people's oral health, and I want to add value to people's oral health. I want to make a difference in as far as the quality of oral health of a human being. And I cannot settle for less other than seeing people smiling, and they have a reason to smile, they have a reason to go to work because they are diseased, they are health care, they are caries free, they have no problem regarding oral health issues. So
I'm now head of social workers in Rwandan Hospital. Our daily work is to support people to access to health services in the hospital. This is the first duty. The second is to help, to advocate for the more vulnerable who can't access easily because of fund, of money barrier and whatever, to also access to medication. The third one is to work with other structures in the hospital, even the community, to know exactly the situation, social situation for our client in the hospital.
I can say I'm a 12 years, and I like being a nurse because my profession makes me to feel very close to the people. And now when I'm doing my community work, I'm working mainly with women who have been contaminated with HIV. Yeah. Then I have to make sure that they are taking the medical treatment, if they are having side effect, how they are coping psychologically, and also how they are successful in their everyday life. Yeah. And I have a group of women who are part of a cooperative, and we are working on how they can get project work, income generating basis. Yeah, it is really community focused rather than hospital based. Yeah, but sometimes also I'm working on the clinic for therapeutic intervention. But also because I'm a mental health nurse, during the commemoration period, you know, many people are having psychological crisis, then you have to intervene. Yeah, it depends on for the situation I'm
consult the different clinics. For example, on Monday we consult the oncology patients. On Tuesday, respiratory disease, chronic respiratory disease I mean. And on Wednesday we see the patients of the heart failure and hypertension. On Thursday we see the patients who are having the epilepsy and mental health, and on Friday we see the patients who are having diabetes type 1, type 2. I like education. Yes, to educate people is very important. Yeah, as Mandela says, the education is one of the most powerful tools which you can use to change the world. So when I teach my patients, I think something is changing.
It's very, very important because in Rwanda we have the references of mental health is the psychiatric hospital. But for me, I think we can also prevent the disease. We can also talk about mental health without go in the extreme area. And for me, it's very, very important to work as a clinician, as a clinical psychologist, for preventing. Also in psychotherapy, in certain cases.
But we also get involved in many other community nutrition activities and also hospital nutrition activities where we go and provide assistance in terms of nutrition and also advices on some patients on how combining medical treatments to nutrition can help them with their health. Yeah. And also the prevention part of it as well. We do sensitize people to eat healthy and based on the local food that is.
Umujyanama w'ubuzima yegereye abaturage kandi nkorera nabo hafi. Numva nkunze kuba umujyanama w'ubuzima kubera ko mbere yo kugira icyo tugeza ku baturage dukorera cyangwa dukorana byose biba byabanje kunyuraho kandi no muri nkunda.